Hi, and welcome back to Abnormal Psychology. Now, this particular chapter, we're now doing depressive disorders, bipolar and related disorders, and suicide. Think back over your life this past summer. You may have reflected on it being kind of normal. You may have worked, or perhaps you were in class for the summer, or you met with your friends and socialized in the evening or weekends, and maybe even thought about your future a bit. Perhaps at some point through the summer you broke up with a boyfriend or a girlfriend, or you got a lower mark on a test than you expected, or at work dropped the ball. Well, many of these events may have influenced your mood and that at that particular time, but maybe you were sad, maybe you had a period of low energy and missed a couple of outings with friends. This may have lasted a short while, but you will get over it and you will move on. Having ups and downs is not unusual. And in fact, it is more normal to have time where you feel great and time where you don't. That is normal. Now, this experience is universal, which makes it difficult for most of us to understand overwhelming and incapacitating experience of mood and depressive disorders. Most of us have experienced minor mood changes throughout a day. However, we are able to stay emotionally balanced generally. Unlike our more normal emotional reactions, mood symptoms in depressive and bipolar disorder are much more debilitating. The effect of the person's well-being, school, work, and social functioning are affected, continuing for days, weeks, or months, often occurring for no apparent reason, and involves extreme reactions that cannot be easily explained by what is happening in the person's life. Okay, so let's begin by looking at the symptoms associated with depressed or energized mood states and how clinicians determine if a person has a depressive or bipolar disorder. Depressive disorders are mood disorders where the disturbances in mood are serious enough to impair daily functioning. Now, again, I hearken you to remember Chapter 1 on the 6 conditions of what is an abnormal behavior. It has to adhere to many of that for it to be counted, if you will. There are various kinds of mood disorders, including depressive disorders such as major depression and persistent depressive disorder, and disorders involving mood swings such as bipolar disorder and cyclothymic disorder. Major depressive disorder, we're going to start there. People with major depressive disorder experience profound changes in mood that impair their ability. Again, I will probably say this in every section, but take a look at the table, in this case 4.1 and 4.2, looking at the diagnostic tables for major depression. Okay? There are many associated features of major depression, including depressed mood, changes in appetite, difficulty sleeping, reduced sense of pleasure in formally enjoyable activities, feelings of fatigue or loss of energy, sense of worthlessness, excessive or misplaced guilt, difficulties concentrating, thinking clearly and making decisions, repeated thoughts of death or suicide, attempts at suicide, or even psychotic behaviors like hallucinations and delusions. Now, these symptoms are not something that can just be shook off. These are persistent and debilitating. About twice as many women as men seem to be affected by major depression, but the reasons for this gender difference remain unclear. Depression can begin or reoccur at any age. But the risk of initial onset of depression is age-related. Major depressive disorder has been increasing worldwide. We can introduce here the depression in childhood and adolescence. Depressed children and adolescents typically show a greater sense of hopelessness, display more cognitive errors, and negative attributions. For example, blaming themselves for the negative events that occur. Have lower perceived competence or self-efficacy, and have lower self-esteem than do their non-depressed peers. Now, they often report episodes of sadness, crying, apathy, as well as insomnia, fatigue, and poor appetite. They may refuse to attend school, express fears of their parents dying, and clinging to their parents or retreating to their rooms. They may have suicidal thoughts or even attempt suicide. Depression may also be masked by other problems such as conduct and school-related problems, physical complaints, and overreactivity. Some people report that moods are affected by seasonal weather, most notably winter and summer. Feeling good in the summer, longer daylight, moody, depressed in the winter because of the shorter days. And it's called the seasonal affective disorder, or SAD. Again, it affects women more often than men. It's most common among young adults. Possibly occurs in children, but not commonly as in young adults. Some of the features associated with SAD include fatigue, excessive sleep, craving for carbohydrates, and then, of course, weight gain. Major depressive disorder with peripartum onset is an addition to the new DSM-5 and is characterized by persistent and severe mood changes following childbirth. Now, this used to be known as postpartum depression. The risks for depression include age, socioeconomic status, and marital status. For persistent depressive disorder, well, it's a form of chronic depression, dysthymia. This is a milder than the major depression, but may nevertheless be associated with impaired functioning and in social and occupational roles. Now, it's noted that both major and persistent depressive disorders are unipolar. This is the mood disturbances that are only in one direction, down, depression. Some people have a fluctuation in mood in both directions, both down and up, which are more extreme than would be considered our usual ups and downs. These types of disorders are known as bipolar. Now, there are three types. There's bipolar 1, bipolar 2, and cyclothymic is the third. We'll start with bipolar 1 disorder. Bipolar 1 disorder is identified by the occurrence of one or more manic episodes, which generally, but not necessarily, occur in persons who have experienced major depressive episodes. Manic episodes, if you're not familiar, are characterized by periods of unrealistically unbridled, heightened euphoria, extreme restlessness, and excessive activity characterized by disorganized behavior and impaired judgment. Check out Table 4.3 for the DSM-5's criteria for mania. Now, there are two common features, and we'll look at them a little bit here. One is known as pressured speech. This is where someone will just have an outpouring of words in which the words seem to surge urgently for expression, but may not always have meaning. And then rapid flight of ideas. And this is characteristic of manic behavior involving rapid speech and changing of topics quickly. Can't stay on topic. Now, even though you think Mania seems better than depression. Remember, these symptoms are also debilitating and extreme. A person experiencing mania may appear jubilant and highly enthusiastic. However, the impact on their life can be very serious, affecting relationships, one's judgments and decisions in all manners of one's life. Bipolar II disorder, in this instance, the depressive episodes occur along with hypomaniac episodes, but without the occurrence of a full-blown manic episode. Hypomania episodes are less severe than manic episodes and are not accompanied by the severe social and occupational problems associated with full-blown manic episodes. Cyclothymic disorder is a type of bipolar disorder characterized by chronic patterns of mild mood swings between depression and hypomania that are not sufficient severity to be classified as bipolar disorder. Okay, so what we've already just done is just looked at what's included in this grouping of depression and bipolar and what did I call it? Was it stress or trauma? No, bipolar and related, sorry. And then suicide we'll do separately. All right, so we'll see you in part 2, or no, we'll see you in part 2. Yes. All right, thanks, and we'll see you in part 2. Bye now.